Also, an unfunded mandate. Governor Quinn has pointed out his concern with this. As you know, in general, Medicaid is a 50-50 split. The states pay 50%, the feds pay 50%. If you increase Medicaid, then you increase the burden on states. Governor Quinn has already cut $140 million out of Illinois Medicaid, but this would increase his burden quite a bit. We've had a number of Democratic and Republican governors cry foul on this because, of course, their revenues are substantially down given the recession. Also, you see that Medicaid is labeled as a high-risk program. It's one of the programs most subject to fraud, waste, and abuse, but the plan would be to expand this program by quite a bit. Next one. Well, you know this chart. This is the debt profile of the United States, and this shows a substantial problem that we have. As my favorite British member of the European Parliament said, David Hanna, you Americans are running out of other people's money. And this clearly shows, according to the nonpartisan Congressional Budget Office, what the debt profile, for a lot of us, I just turned 50, so I plan on being here another 50 years, but as it runs out here, this is mainly for our kids and the tax burden that they would have to pay for the amount that we have borrowed during this generation. Next one. If you look at the long-term debt, we've got several scenarios based on if we accelerate federal spending in this way or not. Remember that the alternative fiscal scenario of the debt going up is probably the more likely one because so much of the Baucus bill depends on cutting Medicare. Question, does Congress ever really cut Medicare? No. Answer, no. While Medicare cuts are projected, Congress, when it actually comes time to impose those cuts, doesn't make it. So actually the higher debt scenario is probably much more likely. And this, I think, it imperils either a future of tremendously high taxes for the American people or a kind of higher inflation. And either one really hurts seniors. Next one. When we look at the 50 states in health insurance, we see 50 different models of what to do and what not to do in health care. The smoking hole of health insurance in the United States is the state of New Jersey, run by the trial lawyers, absolutely no reform whatsoever. They have pushed the cost of insuring a patient up to $5,326 per patient. Despite its reputation, the best state in the union is the state of California that passed a comprehensive liability reform in 1976. California medical malpractice insurance premiums since enactment have gone up 282%. That's a lot. But in the rest of the United States, they've gone up almost 1,000%. So the people of California enjoy much lower cost health insurance, much broader coverage, because they have much more reform. My concern about the Baucus bill is it has one section on lawsuit reform. And that is a sense of the Senate that we should consider lawsuit reform at some time. That's it. There are a number of provisions of the Baucus bill, section 132, 151, 153, 451, that actually increase the opportunities for lawsuits in America. But your ability to sue does not include your ability to sue the government, which under their plan would be a #1 provider. Section 223, 1123, 1151, 1301, and 1303 all would deny you the ability to sue the government when it makes your health care decisions. And so I think that's a fairly unbalanced approach. And the more centrist approach that we outline would be the better one. Next one. So that focuses our attention. But I'd now like to, for a brief presentation, introduce Dr. Jay Alexander, the head of our medical advisory team. And someone who is extremely active on healthcare. A round of applause for Jay Alexander.
I got so many handouts as I walked in the door. Some of mine I have to read. Yes. Anyhow, I got really involved in this for a number of reasons. Like many of you, I'm a parent. I have 2 children. Both of them are in their 20s, out of college, looking for jobs, on my COBRA policy for the time being, and I'm going to have to get them private plans soon. So they're going to be part of the many uninsured soon, unless I do something about that myself. I'm also a small business owner. We're a 12 cardiologist practice that's centered in Bannockburn. We have about 45 employees. We pay their health insurance. It's actually the second largest outside of salary expense that we have. The first largest is malpractice premiums. Malpractice premiums for our group are about, for the 12 members, a little over $700,000 a year. Our health insurance is probably about $400,000 a year. We've been able to keep it down by increasing the deductibles, like many small businesses have done that have insurance. So we're spending over $1 million a year between medical liability premiums and healthcare premiums. It's a lot of money. Contrary to popular opinion, we cannot take that and put that back on our patients, because we actually have fixed prices, and our prices are fixed by Medicare and by the insurance industry. So, in fact, from that perspective, I have the same pain that many of you have. I have a different pain also, because I sit in rooms with patients that can't afford their medicines, can't afford the tests that are done, can't afford the co-pays, and people that avoid coming to see me because, in fact, they just frankly can't afford the health care they get. And today it's getting obviously worse with the economy and the issues that we have to deal with in the economy, people losing their jobs, losing their insurance. So I feel this and see this every day, just as all of you do. Physicians have a somewhat unique outlook on health reform. Many would think that we should be anti-health reform. In fact, we're not. We're pro-health reform. I believe that we need health reform. We need health reform now. But we need the right health reform. And health reform needs to be done in a way that's carefully done, that assures everyone in some way. And we need to do that. We also need to help create a better delivery system in this country. The problems that we have are uncoordinated care. We are not the best at chronic care, but we do give a good quality health care. So we do need to improve the kind of care that we give. We also know that the care that we give is exceedingly expensive, and we also understand that that curve has to be bent downward. So we understand all the issues in regard to health care, and there's no question, and when you go to Washington and you speak to some very bright people, it's amazing how it's dumbed down when it comes to health care, because it's such a tough topic. It is a very difficult topic, and it's gone from policy to politics, unfortunately. So we're dealing with the politics of healthcare now, and I'm very concerned about the law of unintended consequences that are going to come out of Washington probably in the next several months. When we look at healthcare, there are certain principles that I believe we need to look at strongly. We need to improve the delivery system of healthcare, and I'm going to start with physicians. We need to put our patients first, and we need to be patient-centric. We need to develop a more coordinated sense of how we give healthcare. We need to communicate better, and I would hope that through the stimulus package and the push toward electronic health records, we can actually make that happen. In part, we're going to have to make that happen with the help of changes of other laws too, which I think the government has been a little difficult in getting them to change, such as some of the HIPAA issues. We need every patient in this room and every patient in the United States to have a unique patient identifier. That unique patient number will make it so that when you go to Florida or you go to California to visit a relative and you have a medical problem, that they'll actually pull up the right John Smith or the right James Doe.